Prostate cancer is by far the most common cancer in men. According to the American Cancer Society, nearly 2 million men are currently affected by it. The risk factors for the disease include being over the age of 40, being of African American descent, and having a family history of prostate cancer.
So, if an individual has a father, brother, uncle with prostate cancer, depending on how many relatives and whether it's first degree, second degree, they are clearly at increased risks.
At the age of 68, Bobby Smith is still very competitive. Today, near his home in Los Angeles, he's working on his golf swing. 40 years ago, Bobby Smith spent his Sunday afternoons as a defensive back in the National Football League. His first 3 seasons were with the then Los Angeles Rams. And then his last 2 seasons were with the Detroit Lions. But years after his football career ended, Bobby faced a formidable foe off the field: prostate cancer.
In my own particular case, I didn't want to hear that there were cancer cells in my prostate when it happened. And my initial reaction was, I'm going to die.
This is not an unusual patient response. Doctors report that most men don't want to talk about prostate cancer or prostate health until it affects them.
The man who has localized prostate is concerned about 2 things: continence and potency. The man that I'm talking about is concerned about 1 thing: survival. And not just survival, but survival with a good quality of life.
The prostate gland is a chestnut-sized organ located below the bladder. It's part of the male reproductive system, and its function is to add proteins to semen. An increase in one of these proteins, prostate-specific antigen, or PSA, may be the first sign that there is a problem. The PSA test is routinely given to men after age 50.
There is no PSA level at which you can feel safe that you don't have prostate cancer. And so it is how the PSA changes from year to year that matters.
Bobby Smith's cancer was contained to the prostate. He wanted to avoid surgery, so he opted for radioactive seeds, which are implanted in the prostate to fight the cancer.
I chose the seed implants. And what happened is I went into the hospital on a Friday, had the procedure done, and I was back at work the following Tuesday or Wednesday, I think. And so that was perfect for me.
When caught early, nearly 99% of men with prostate cancer survive at least 5 years, according to the American Cancer Society. From evaluation to treatment, doctors and patients say the medical care for prostate cancer has improved in just the past 5 years. So there is every reason for men and their families to have confidence in successfully fighting the disease.